Hey guys, it's Dr. Emer. Just really quickly going to show you a cool procedure called subcision. You come really close. We're using a needle that has a sharp end, almost like a razor blade. And in the area where my patient has some scarring, you put a little numbing medicine, you go under the skin, and you do a windshield wiper effect where what we try and do is release the tethered scar tissue from the skin above so that we can place a little bit of filler underneath, and that will allow us to lift the indent and make it look more plump. In this area, you don't want to be crazy aggressive because you can make what's called kind of laxity or loose skin. He's a young, good-looking guy. You don't want it to be like looser. You don't want him to look like he has no scars but has some aging. So we're just being really gentle here, kind of cutting the bands. You can see now that I'm able to really move across. You're gonna hold right there. Go ahead, hold right there with your left hand. Just firm, and then turn the other way. One more gauze, thank you. Now we're gonna do that same thing over here. He has a spot here. You can see a little bit of a scar. We put a little bit of numbing. I try and do not a ton of numbing, even though it does hurt a little bit. This area you can feel more scar tissue here, which we're breaking apart. You can see that. Now, and as I move, you don't see that banding anymore. See? The banding's going away, and the blade's moving through the tissue much more easily. So now it's freed up, which is great. Hold right there. And then we can use some filler, which I'll show you guys really quick. I'm going to come over here. Good, let go. Good, turn a little. We're just going to put a teeny bit of filler right into that space. Usually no more than even 0.05 or 0.1 is all that's needed. Just kind of plump up that space. We're using Bellafill, which is a collagen producing filler. Hold right there. This will long-term build collagen there. You can see crystals are very different than other fillers because they're made of something called PMMA, which is an acrylic polymer basically. But when you do micro droplets in the skin, it builds collagen. So here we did nice release of the tissue, a little bit more, and it can also even subside a little with this needle, just making sure everything's good. Great, everything's perfect there. So just putting a small amount again. You don't want to overdo it because you don't want this area to look puffy. But also, since this is the areas that bothered him, we really want to make sure. So that's subcision with Bellafill to lift independent scars.